Joining us now via Skype, the medical director for the Northeast Regional Health Office, Dr. David Kirschke. My goodness, Dr. Kirschke, if we had one of those cards you could punch every time you were on, you would be due for a free yogurt about right now. So welcome back again. Thank you for coming in on a Friday.
Thank you.
Who do you want to be at those testing locations tomorrow?
Yeah, so we encourage anyone that has signs or symptoms that could be related to coronavirus, COVID-19, to come get tested. So that's anyone with cough, fever, or shortness of breath, even atypical symptoms, congestion, sore throat, body aches. If you have any concerns that you may have coronavirus, please come out and get tested.
Sounds like you're not staying yet for everybody, even people who are feeling on top of the world, but maybe are curious to come. You're saying let's still make sure we're doing this for those who are not feeling well, right?
Well, that's the primary people that we want to test, but anybody can come get tested.
All right. The governor today released some guidelines for churches to begin safely gathering, saying never were they prohibited from gathering, but for large groups, it's a concern. Those guidelines are all posted on our website. One of the things that was on there, I noticed, was there's a very strong recommendation that people come with face coverings. Why do you continue to believe that that is an important thing?
Yeah, so face coverings and social distancing in general are going to be very important as things start to reopen. And actually, the governor's guidance does say that they don't necessarily recommend that churches do gather. It's up to the churches, but churches may want to postpone in-person gatherings for some time, especially to protect the most vulnerable in the community, so that, you know, they're elderly and people with medical conditions that put them at high risk. But if people do gather, there's a whole list of recommendations, including wearing face coverings to protect if you're asymptomatically infected, spreading it to other parishioners. So really, again, social distancing is going to be more important than ever as we start to reopen. One of the things is, you know, our region has done such a great job through hard work and sacrifice to get to a point where we have very little coronavirus, but coronavirus can come back with a vengeance in just a matter of weeks if we don't do this right.
Am I right then that the suggestion seems to be if you can continue to meet virtually and do the online church services and continue to connect but not gather in large groups, that's what you would like to see as a public health official. Is that accurate?
So that is the safest thing going forward. We do expect coronavirus cases are going to increase in our area as we start to reopen. In Tennessee, they're still increasing. They have not decreased. The rate of increase of cases is still going up. So we do expect to see more cases. So to protect those people, you know, that are most at risk, we do recommend, if churches can do that, that they still try to be as safe as possible.
By our count here at News Channel 11, using Department of Health numbers, we're at about 21 active cases in Northeast Tennessee today, down from around 35. And I know that number may be up or down, but we saw a drop in active cases based on the number of recovery. What do you think? What are you attributing all this to a really low rate, it seems, compared to other parts of the state?
Yeah, I mean, I think, well, geographically, you know, we're a little bit more spread out than they are in Middle Tennessee, but I think, like I said, just a lot of hard work and sacrifice by everybody in terms of social distancing, businesses being closed, you know, people not gathering. So we have gained a lot of ground through all those efforts. We don't really want to see us waste that and go back to a situation, you know, in a matter of weeks where we're in crisis. There's a model out of Vanderbilt that shows that if we don't do reopening right, and between 6 weeks and 6 months, we could be at a point where hospitals are full and we're having to reconsider stay-at-home orders again.
Wow. Doc, I'd like to get your take on antibody testing, which is something that we've heard about and talked about. We're hearing now that people are starting to get antibody tests here in the area, and some of them, we heard from one individual today who found out she got an antibody test and actually didn't know she had COVID-19, but she actually had it according to that test result that came back in. What can you tell us about antibody testing as it stands right now in our part of the state?
Yeah, so I'm not familiar with what test this person had. There are lots of different antibody tests. Some are a lot better than others. So it's hard to actually interpret unless you have to know the reliability of the actual test. So antibody test, if you're positive, there's more of a risk that it could be a false positive. And if you are positive, we don't know yet if that indicates that you're immune to coronavirus. So we're still trying to figure out how we're going to be interpreting these results as they come in. And again, a lot of it depends on the quality of the lab where the test is done.
But are they moving out? I mean, are you seeing a deployment of this testing here in our area? Are more being done? And do you think we'll come to a point where we'll begin to actually track antibody test results?
Yeah, so an antibody test, so if someone gets an antibody test and that's positive, we typically would recommend that they get the PCR test, which is the test we're doing at all our test sites, that tells you whether you're currently infected or not, because that's actually currently more important to know if you're infected, because then you're potentially contagious to other people. So just the antibody tests have to be interpreted with care. So we recommend that people discuss those with their doctor.
Heading into a weekend that's beautiful, we'll wrap up with this. Your advice to people as they're trying to think, okay, some stuff's open now. You know, I can maybe go out and go do some things I couldn't do a few weeks ago. Beautiful weather. What's your parting shot for those folks?
Yeah, so being outside is the perfect antidote to cabin fever, which we're all suffering from a little bit. But we do recommend social distancing, avoid crowds. If you are going into newly opened businesses, I recommend that you make sure that the businesses are complying with all the recommendations on social distancing, and avoid businesses that look like they're not. So just try to be as safe as possible. Again, we have to do this right, or else we're going to be back in a situation where we may be talking about reinstituting stay at home.
Dr. David Kirschke, we appreciate you as always. Thanks so much, and good luck with the testing sites around Northeast Tennessee this weekend.
Yeah, I'll be out in Hampton tomorrow all day.
All right. We appreciate your time as always.